The universal hand table is a new must-have tool for hand surgery. It's a table for surgeons designed by surgeons. This patented material, which complies with CE marking and comes with a 5-year warranty, is innovative in many ways. Conceived, developed and built in the design offices of the Coutier Industry Company in France, the universal hand table puts back the hand of the patient at the center of the operating procedure. The universal hand table is an independent and mobile system which offers numerous advantages for surgeons, brings more comfort to patients and simplifies the work of the team in the operating room. It's perfectly suited to an ambulatory activity carried out under local anesthesia and makes it possible to operate patients directly on their trolley. This novelty helps to avoid the transfer from the stretcher to the classical operating table. This results in a substantial saving of time, more comfort for the patients, and a facilitated work for the nurses and stretchers bearers. Thanks to the ergonomics of the table, the stretcher can be adapted in either vertical or horizontal position in order to perfectly adjust the arm of the patient. Not only has the table got a strong stainless steel frame, which makes it very stable, it's also equipped with a height-adjustable leg designed to choose the level of the worktop. 2 rotating bins are fixed to the legs while remaining retractable and removable. 2 magnets are intended to collect the blades, needle or little pieces of pins. The surgeons who have designed the table wanted to be fully radiolucent and equipped with a notch which enabled to bring forward the arch of the fluoroscopic device. It's very useful to fractures reductions, and an horizontal traction system maintains the reduction during the confection of casts. The large tabletop of the universal hand table is already very comfortable in its initial configuration, but can be widened thanks to the removable XL extension, which adapts the working surface to any additional material. An option is an extra board, which can be put on the side when the fluoroscopic device has to go ahead, by example, during foot surgery. This universal board accepts any type of echographic device. It adapts itself to the shape of the device, computer, tablet, or vertical one. One of the major innovations of the table is its support pole. This system has multiple benefits. It efficiently maintains the hand above the shoulder to ensure the blood drainage of the arm by gravity and perform the antiseptic coating. It supports the sterile field. It contains a support rake for the wire, the cable of the engine and the water catheter for arthroscopy. The pole can be reverted on its axis, this allowing to go from left hand to right hand in a few seconds. These features make the universal hand table totally reversible. The pole can hold a mirror or a numeric pad in order to show the operation to the patient, record images of the surgical procedure, or even entertain children. The perch of the pole can be used to block the arm for the arthroscopy. The pole can hold an axis, removable and sterile, which enables a very quick installation to perform a vertically oriented arthroscopy. This axis can also hold an arch, which can be enabled to perform an horizontally arthroscopy and easily go from one to the other. The wrist remains perfectly accessible. Safe, multifunctional, robust, adaptable are some of the qualifiers which makes this universal hand table, without question, the new must-have tool for hand surgery.